My name is Virginia Hutchins. I'm an RN in the RN to BSN program for USC Upstate, and this is my final health assessment for the health assessment course. Here we have client MH, you're 62-year-old female. Your height is 5'8", and you are 242 pounds. Is that correct? Okay. And the blood pressure that we just obtained prior to starting this on your right arm in a sitting position was 138/69, or excuse me, 89. We are going to start with a mental health assessment, and then we'll move on to 2 physical assessments. We'll do the skin, hair, and nails, and then we'll end with head, face, and neck. Okay, so I'll just be, during the assessment, stating my findings, what I visualize, and we'll start with inspection, where I just look, and then we'll go to palpation where I'm actually touching. Okay, if anything is uncomfortable, if you need to change positions or anything causes pain or discomfort, just let me know. Okay, so first we will start with the mental health assessment, like I said before. So you appear well kept, you're clean, clothes match, they are clean, like I said. Your hair is brushed, everything appears well put together. Are you having any thoughts of wanting to hurt yourself today? Any thoughts of suicide?
No.
Okay. Can you tell me your date of birth?
May 1st, 1954.
Okay. And tell me where we are.
We are in Sumter, South Carolina, in my house.
Okay, and explain what we're doing today.
And today, October the 6th, 2016, we are doing some mental assessments and physical assessments.
Okay, very good. So you're oriented to person, place, time, and situation. I am going to do a little memory game now where I give you 4 unrelated words, and then we will check back and see if you remember them later on. Okay? So the first word is unicorn, towel, apple, and train. Okay? So go ahead and just tell me those words
Unicorn,
that I said.
Towel, apple, train.
Okay, and just want to note that your speech is very clear, concise. You're able to answer my questions immediately and appropriately. Moving on to your thought processes, can you share with us a couple of goals that you have, personal health goals for yourself?
Sure. One thing I would like to increase my stamina and be able to walk longer distances for a longer time. And I would also like to cut back on salt and sugar in my diet.
Okay, both very attainable, relevant to your personal health. Very good. All right, so now moving on to skin, hair, and nails. First, I'm just going to inspect your skin, and then I'll go on to actually palpating or touching. Okay, so your skin appears clean. It's kind of evenly tanned. There are freckles, numerous freckles on both upper arms and chest. There is a mole on the right upper part of the lower arm, just below the elbow, that we would call a nevus. Appears to be primary, probably compound or intradermal. It does appear a little raised, but there's no hair, no irregularities. The edges appear symmetrical, and it's all kind of the same color, a light brown, and it is less than 6 millimeters. So that's all good things when we're looking at lesions.
Okay, I see my dermatologist, and he's checked it every year, and I've had it ever since I can remember.
Okay, very good. And then no other vascular lesions or anything like that noted. So now I'll go on to palpating. Okay, I'm just going to touch the skin. It's nice and smooth, dry, warm to the touch. No lesions felt, no edema, anywhere swelling that I can feel. Just feeling that nevus. Again, it is a little raised, but it's smooth, and it returns to its normal color on palpation, so nothing to worry about there. Will you show me the palms of your hands?
Mm-hmm.
Okay, they are nice and pink, and they appear smooth. I'm going to go ahead and touch them, and they are nice and smooth, dry. Again, your skin everywhere is closed, no open wounds, and you can go ahead and relax those. And evenly the same color with just the multiple freckles noted. I'm going to test your skin turgor next. I'm going to do some tenting. So I'll just pinch the skin right above your clavicle area, and it comes up very quick and goes down very quick. I'm going to do the other side just to compare. All right, very good. So it just shows that your skin has good turgor. It's basically well moisturized. You're not dehydrated. So very good. All right, so now we're going to move on to the nails. If you can hold up both hands for me, just going to inspect them and then I'll touch each one, okay?
Mhm.
So I can see that you have acrylic nail coating on each nail. It looks nice and smooth and shiny. It's light pink in color with white edges. No cracks or breaks, no chipping noted on any of the nails, no open areas, redness, definitely not any chewing of the nails or anything. Okay, I'm just gonna feel each one. They do feel as smooth as they look. There is a little bit of roundness on the nails, which is normal. And the nail folds on either side of the nails are symmetrical, nice and smooth. Let's see. And the nail beds, when I press, they're very nice and firm when I'm doing that.
No.
Okay, I just want to check on this hand. They all appear the same and in good condition. And then I'm going to check capillary refill time on each one, okay? And it should be less than 3 seconds. And so far they're looking good. You can still see that very well and easily through the acrylic nail coating. All right, very good. Cap refill time is less than 3 seconds on both hands. And then last, I'm going to look at the from a side view of the nail, and it is nail bed degree of 160 degrees, which is exactly what we want. So that's very good. Okay, you can relax your hands now.
Okay.
So now we'll move on to your scalp and hair. So your hair is short. It is reddish brown in color, a little bit of gray on both areas, just anterior to the bilateral ears. I'm going to go ahead and touch, okay? All right, feels nice and clean. It's a little coarse, but it's thick. It's easily movable through my fingers. I can separate all the different hairs individually. The scalp appears nice and clean, dry. It's also warm to the touch, just like your regular skin. And no redness noted, no tenderness anywhere.
No.
I'm gonna kind of feel all over. I don't feel any lesions, any lumps or bumps. And again, no flaking noted that I could see when looking through your scalp. Okay. And then the last thing, I'm gonna feel the skin behind both ears. Okay. It is nice and smooth, no redness. Again, nice and dry. And looks the same on both sides. So let me see if you can tell me those 4 unrelated words really quick that we talked about earlier.
Unicorn, towel, apple, train.
Okay, very good. Okay, moving on now to the head, face, and neck assessment. Okay, so first, just kind of looking at your head straight on. You are holding it erect, independently. It's midline in your body, as it should be. Your accessory neck muscles appear symmetrical, nothing's strained, nothing's protruding, no growths or tumors. And do you have any limitations on movement of your head or neck?
No.
Okay, can you move it from side to side for me?
Mm-hmm.
And forward and back?
Mm-hmm.
And then kind of in a round circular motion.
Mm-hmm.
Okay, any pain or limitations there?
No.
Okay, so range of motion is full and active, and all your movements are symmetrical and steady. Okay, so very good. So let's move back to the skull. We kind of already did that a little bit with the scalp and the hair, but when I was palpating your skull, everything felt nice and smooth, round, so we would describe that as normal cephalic. Okay, your temporal arteries, I'm going to palpate on both sides, nice and smooth. No growth or swelling noted on either side. Mm-hmm. And then we're going to go to the temporomandibular joint, or TMJ. Mm-hmm. And I'm going to kind of cut both of my hands around the base of your jaw and have you open and close your jaw for me. Okay. Okay. So open your jaw as wide. Okay. So going back to your head, we're going to end with the temporomandibular joint, or TMJ. I'm going to place, kind of cup my hands over the bottom part of your jaw and have you open your jaw as wide as you can and then close it. Okay? Okay? All right, go ahead. And close. One more time. Very good. Okay, any pain or discomfort without any limitations?
No.
Okay. Felt a little bit of crepitus over the right side, but I know you did tell me that you have TMJ disorder and you've had some trouble with the jaw popping out of place and pain with that in the past, but nothing recent?
No, not for several years.
Okay. And that's normal, you know, to have that crepitus present when you've had issues with it.
Okay.
Okay, so now we will move on to just your face. You appear relaxed. Your expression is appropriate for what's going on. Everything appears symmetrical on bilateral sides of your face. Your eyebrows, your palpebral fissures, your nasolabial folds, and the edges of your mouth are all symmetrical on both sides. Everything's kind of congruent there, and no history of strokes, correct?
Correct.
Okay, very good. All right, now we're going to assess a few of the cranial nerves, having you do different activities with your face and different muscles in the head and neck area. Okay, so we'll start with cranial nerve 7. I'm going to have you do 3 different activities to assess part of cranial nerve 7. Okay, if you'll puff your cheeks out, very good. If you will show your teeth, okay, and then if you will close your eyes tightly. Very good. Okay, you're able to do that easily with no problems, and everything appears symmetrical when you do that. Okay, and then moving on to cranial nerve 5, we're going to assess sharp and dull pain, pressure, and light touch. That's just testing part of the cranial nerve 5 on your face. Okay, so I'm just going to grab a couple of supplies. Got a cotton wisp here. I'm going to touch a few different parts of your face, and you just say now when you feel it. Okay?
Now. 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 Now.
Okay, very good. And then we're going to move on to, I've got a cotton tip applicator, just a little bit harder pressure with the cotton tip, and then we'll end with the other end.
Okay.
Okay? And again, just tell me now.
Okay.
When you feel it.
Now. 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 Now.
Very good. Last part.
Now. 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 Now.
Okay. Any of that uncomfortable
No.
or hurt? Okay.
No.
And your responses were prompt and quick, no delays, so that part of cranial nerve 5 is intact. The last part just tests your bilateral temporal and masseter muscles of your jaw. So if you can just clench your teeth, hang on,
Okay.
while I'm touching and providing a little bit of resistance. Okay?
Okay.
All right, go ahead. Okay, so I can feel those muscles. They're nice and tight. I'm going to pull down a little bit on your chin just to see if I can separate your jaw, and you resist against me, okay? Okay, very good. No separation of the jaw. Those muscles are very nice and strong.
Okay.
Okay? All right, so moving on to the neck. We kind of already talked about it before, that it's holding your head up nice and erect, midline of the body. Nothing seems strange, no lumps, tumors, or anything, lesions visible. Just going to feel the skin. It looks the same as the other skin I've touched, and it is, again, nice and smooth, dry. No hair present here, and it's evenly colored with some freckles present. I note about a 1-inch horizontal scar under your chin from previous surgery, but it's nice and healed. And then I'm going to palpate both salivary glands right here. The parotid salivary glands. No visible swelling on either side, and nothing feels swollen or firm. Any pain with that?
No.
Any problems with the salivary glands? Okay, very good. All right, next I'm going to be palpating several different lymph nodes. Okay, I'm going to be using both hands so that I can assess both sides, and then I'll end with standing up to do the last lymph nodes. I'm going to be moving my hands in a circular motion and just with light palpation. Okay, and just let me know if anything is uncomfortable.
Okay.
Okay, so first we're going to start with the preauricular. Okay, and then we'll move to postauricular, and then occipital, and then the submandibular or maxillary, and then the submental below the chin area, and then the anterior cervical, the posterior cervical, and then the supraclavicular. I'll get you to lean your head back just a little bit. And then I'm going to end with the deep cervical chain. Okay? And I'm just going to palpate right here. Get you to put your head down just a little bit. And again, everything feels nice and soft. Any discomfort with any of that?
No.
Okay, very good. Okay, a few more palpations and then we'll be almost done. Okay, I'm gonna palpate the trachea. So I'll get you to lean your head back just a little bit, and I'm gonna put my index finger in the sternal notch,
Okay.
and see if there's any movement away from the midline of the trachea, and it is not deviated at all. Appears midline. I'm gonna just kind of do the same thing to the other area, and again, there's no protrusions. No discomfort with doing that?
No.
Okay. And then moving on to the thyroid. Now I'm going to palpate the thyroid. I'm going to use a posterior approach to that and have you take a sip of water from this cup.
Okay.
Okay? So you want to go ahead and grab that to be ready.
Okay.
I'm going to use one hand to stabilize and then the other hand to kind of displace. And I'll get you to go ahead and take a sip of water. And no palpation of the thyroid was able to be done, but that is very normal for most adults. Okay, I'll put that back here for you.
Okay.
And then we're going to end with assessing cranial nerve 11. We are looking at the trapezius muscle first. I'm going to get you to shrug both shoulders against my resistance bilaterally. So go ahead and shrug them up and down, and then one more time, and down. Very good. Muscle strength is equal bilaterally. And then we're going to end with the sternocleidomastoid muscle, and I'm going to get you to turn your head from side to side with my resistance against the side of your jaw. Okay? So if you will turn your head that way. Very good. And then the other way. Very good. Again, muscle strength is equal bilaterally. Okay? Very much. Thank you for your time.